Hello and Assalamualaikum. Today, I would like to present about spinal cord injury. Have you heard about a spinal cord injury? It is many people um, who suffer from the spinal cord injury. That now I will explain all about the spinal cord injury. All right, proceed. This is definition of spinal cord injury. Spinal cord is a long bone that connects to brains and lay within the vertebral canals and got many spinal emerges nerves. There is 31 pair of spinal nerves in the spinal cord, such as 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. The spinal cord and brains contain the central nervous system. The spinal cord consists of nerve fiber to transmit impulse to and from brain. It is covered by three connective tissue that called meaningless colorless fluids to solve the spinal cord from shocks. So that is the diagram. Uh, diagram shows that the brains with spinal cord that is a cervical, thoracic, lumbar, and sacral coccygeal. So we can see that C1 and C8 is the neck muscle diaphragms, deltoid, shoulder, which is shoulders, wrist, triceps, and finger. For thoracic is the hands. For T1 and T11 got hands, intercostal, which is trunks, abdominals, and ejaculations. And from the lumbars, there is a L1 until to L5, that is hips, quadriceps, hamstrings, knees, and foot. From sacrals is as S2 until S3, which is a penile erections, bowel, and bladder. So the spinal cord is involved in the whole body that connects impulse to the body. What is spinal cord injury? It is the damage to the spinal cord that can cause temporary or permanent changes in its function. The symptoms that can cause the problem such as a lost muscle function, which is the paralysis, loss of sensations, which is a numbness or cannot feel anything, and autonomic nervous system. It is a damage to the spinal cord that causes temporary or permanent changes in its function. Symptoms may include loss of muscle function, sensation, and autonomy that I will talk before. Okay, so we can proceed. That is a type of spinal cord injury, which is a cervical spinal cord injury. As you can see, the cervical spinal cord injury is from the head and neck region above the shoulders affect cervical spinal cord injuries. Secondly, is from a lumbar spinal cord injury, that is the hips and legs are affected also by the lumbar spinal cord injuries. Besides, thoracic spinal cord injury, this is the upper chest, mid-back, and abdominal muscle are affected by thoracic spinal cord injury. And lastly, a sacral spinal cord injury, that is the hips, back of the thigh, which is hamstring, buttocks, and pelvic organ affected by the injuries to the sacral spinal cord. Cause of spinal cord injury. The most common cause of spinal cord injury in the chart. So the most causes of spinal cord injury, as you can see, is it from fall. It is a 41.7% people fall to the ground, and that cause an injury in spinal cord. So the secondly was from road traffic accident. Most of the people in Malaysia and also in the world not wearing the safety such as helmet to drive the motorcycle, that can cause a serious injury in the spinal. And also we can include in the sports and recreation also, there's a common injury of spinal cord. It is because the most of the injury is come from touch sports such as soccer, rugby, football, and hockey. Others is unspecified. That is unknown, um, violent, and an act of violence, which is people who are forced to lifting something that having weight that can cause the injury. So here is the symptom of spinal cord injury. There are two types of paralysis from the spinal cord injury. That is tetraplegia and also as known as a quadriplegia. It means it can cause your arms, hands, trunks, legs, and pelvic affected by spinal cord injury. Paraplegia that is paralyzed all of part of trunks, legs, and pelvic organ. These two is more to incomplete and complete spinal cord injury. Paraplegia is the complete spinal cord injury, and tetraplegia is incomplete for spinal cord injury. So spinal cord injury got many signs and symptoms. Uh, as you can see in the slides, there is a loss of movements, loss of sensations, loss of bowel or bladder control, such as we cannot hold to pee, and increased reflex activity or spasm. It easily got cramp in the muscles and difficulty of breathing, coughing, or clearing secretions from throats. You can see the diagram is about the signs and symptoms of spinal cord injury. And also got a weakness of paralysis, and difficulty in walking, and reduced sexual functions. Non-surgical treatment. You can see if we don't use the surgical treatment, we can use for non-surgical treatment, such as we can use to do some exercise or do some anything to prevent the furthermore injury in the spinal cord. And thirdly is for follow-up, so we can follow up from the specialist to know about a severe of injury that happen in our body. And lastly is from rehabilitations. After the surgeon, after the surgical, or after the injury that caused in ourselves, we need to do some rehabilitations. Maybe it will increase our injury or prevent from the injury. So you can see in the diagram a spinal cord injury treatment using patient stem cell. Patient within 2 weeks of injury, inject bone marrow fluids, is a culture stem cells, and return the cell to the patient via intravenous drip. This is from the rehabilitation will be conducted simultaneously. For safety and medical considerations, for safety, for spinal cord injury, if you got a spinal cord injury, you need to do something to safety issues and stay safe from more injury to your body. So we need to protect your body from bumps, bruises, cuts, and scrape while doing activity, because it can cause a more injury from our body. Wear proper clothing. It is considered to the weather and temperature, so that we cannot add for more injury in our body. Wear proper swimwear, including surf shoes in any body of water. Wearing proper swimwear is very important when doing some water recreational activity, because if stay too long in wet, it can cause a skin problem in the body. So special consideration when involving them to leisure and recreational activities. Leisure and recreational activity are useful to a person that have spinal cord injury, but it is still in studying on how to make them involved in recreational activity. There is a benefit involving to leisure and recreational activity, such as for satisfaction of job, health, and financial results. It is good for spinal cord injury for release their tensions and increase their health for doing the recreational activity. It also can increase the encourage and quality of life. Most of the people who are involved in the spinal cord injury will depress or stress because of the injury that cannot give them to independence to move. It is also can decrease the disease such as cardiovascular disease, obesity, and cancer from recreational activities and leisure. Also can make people more healthier when doing some activities because it can um, give more stamina to the patients. People with disability can even more active and enjoy physical and emotional health. Yeah, this is because people are more um, depressed when doing activity or shy because the disability that happened to him or her. So from leisure and recreational activity, it can make a person who are encouraged and motivational to join the recreational activity. So lastly is increased social interaction with people. As I've told you before, some patients are shy or embrace himself or herself due to the injury. So from involving them to leisure and recreational activity, it can make them interact to others and communicate to others. So it can increase their motivate and self-esteem to with the people. All right. So that is how that is how I present the spinal cord injury. Hope you understand and enjoy. Thank you.
Okay, do you guys know what is spina bifida? It's okay. Today I will talk about spina bifida. Before that, I will introduce myself. My name is Mohamad Asymawi bin Ramli. I'm a student from Faculty of Sports Science and Recreation, UITM Shah Alam. Let's go. Okay, we start with the definition of spina bifida. It comes from Latin word called spina bifida, which means spine split. It's quite a good description because it is the birth defect that occurs when the spine and spinal cord doesn't form properly, which means that where the tissue on the spinal cord from the left and right side of the back normally come over the spinal cord to protect it, but completely made up from a nice seal, leaving behind various degrees of down the middle of the lower back. Usually, it starts to occur during the 8 weeks of the baby. It's a type of neutral tube defect, also known as NTD. It can happen anywhere across the spine if neutral tube doesn't close properly. You can refer this picture I've shown you in this presentation. There are three main types of spina bifida. The first one, spina bifida occulta. It is the mildest type of spina bifida, sometimes called hidden. It is because when the doctor doing the prenatal test and it couldn't find the tissue because the tissue is very tiny. There is a small gap on the spine but not opening. It does not cause any disabilities. And the second type is meningocele, also known as meningeal cyst. It is the least common form of spinal bifida. It occurs only at meninges, but not on the spinal nerves. The spinal cord not damaged. It usually no severe symptoms because of it. The sac of fluid coming out through opening in baby's back, unlikely to suffer long-term health problems. And the last one is the myelomeningocele, is the most serious type of spina bifida. It occurs in the third week of embryonic development. Sac of fluid coming out through an opening in baby's back. Part of spinal cord and nerves are damaged. Causes moderate to severe disability. Mostly children also have too much fluid in the brain. In a severe cases, there's a condition called open spina bifida, and this can cause serious damage because the nerve or spinal cord is exposed. It also can cause wrist infection that can lead to such as symptoms like loss of sensation, paralysis, bladder and bowel problem. So these are a few causes that can lead to spina bifida. The first one is still unknown. The second one, mix of both genetic and environmental factors. However, there's a few factors increase risk of baby condition such as low folic acid during pregnancy, family history of spina bifida, and take certain medication. Also, obesity and poorly controlled diabetes also can lead to spina bifida. Okay, we continue with the symptoms of spina bifida. For spina bifida occulta, it will be noticed accidentally. May be seen abnormal tuft or hair, small dimple or birthmark on the area. Can be seen underlying spinal cord using MRI or spinal ultrasound. So, meningocele. Spinal canal remains open along several vertebrae in the lower or middle back. Membranes and spinal cord or nerves protrude at birth, forming a sac. So, myelomeningocele is the weakness or total paralysis, loss of skin sensation in the legs and around bottom. Some may have learning difficulties if suffer hydrocephalus, which means excess fluid in the brain. It also can cause bladder problem because myelomeningocele, when the nerve does not completely perform well. And these are the safety and medical considerations that can treat spina bifida. The first one, prenatal surgery. Second one, postnatal surgery. The third one, urinary catheterization. And also the last one, wheelchair or crutches. For treatment, prenatal surgery, it can be done to close the myelomeningocele, but it can be dangerous to the developing fetus as well as the mother. And then, if the postnatal surgery is be done, it will be done a few days after the baby has given. If postnatal surgery is chosen, it is often done within the few days of the infant life in order to minimize the risk of infection like meningitis. Even if the surgery is successful, people with this condition will need to use additional intervention such as urinary catheterization and also wheelchair or crutches. So in urinary catheterization, a latex polyurethane or silicone tube known as urinary catheter is inserted into the bladder through the urethra. Catheterization allows urine to drain from the bladder for collection. It may also be used to inject liquids used for treatment or diagnosis of bladder conditions. There are some important safety considerations when involved in sports. To improve physical fitness, it is recommended that your child needs at least 1 hour and up to several hours of moderate to vigorous physical activity every day. A combination of moderate and vigorous activities is recommended. A 5 to 10 minute warm-up will help to prepare the body for the activity. And then 10-minute cool down should also follow the activity to remove waste product from muscle so that they don't become sore or stiff. It will encourage the children to be active when they are young, will help to establish routines that can stay with them throughout their life. Rolling activities and jumping from heights should be avoided if your child has a shunt. Most physical and sporting activities are fine for participation, but contact sports such as football should be avoided. So, children living with spina bifida do not have normal sensation. Burns and abrasions can occur easily from hot or rough surface. Consult with your spina bifida service if you are unsure about what activities your child should avoid. As you can see, this is the data and statistics that are found from Centers for Disease Control and Prevention. So, it shows that the neural tube defects prevalence changes before and after folic acid fortification. So, by increasing the folic acid intake among women of childbearing age can help prevent almost 150,000 until 210,000 of the more than 300,000 neural tube defects that occur each year in low and middle resource countries. So that's why a pregnant woman needs to consume more folic acid during pregnancy period.
So I hope you guys understand what I've explained just now. So see you again. Assalamualaikum.
Thank you, Asymawi. Assalamualaikum and hi. My name is Rahmat Hidayat. I will present about polio and muscular dystrophy. Poliomyelitis, or simply called polio. What is polio? Polio is highly infectious viral disease that largely affect children under 5 years of age, caused by 3 types of poliovirus. The virus is transmitted by person to person and will destroy nervous system that causing paralysis. There are 3 types of polio: abortive, non-paralytic, and paralytic. Abortive polio is a minor illness. 80% to 90% children that positive poliovirus is in this type. Next is non-paralytic and paralytic polio. Non-paralytic is symptoms are more severe than abortive, but not as bad as paralytic. In this type, poliovirus enters central nervous system and damage neurons, while paralytic is the most severe, may result in permanent paralysis of certain muscle groups, including breathing muscles and leg muscles. There are 2 types of polio vaccine, which is inactivated poliovirus vaccine (IPV) and oral poliovirus vaccine (OPV). IPV only used in the United States since year 2000 and OPV no longer licensed. Causes and symptoms. Causes: first, spread most often from fecal-oral contact. Second, occurs from poor hand washing or from consuming of contaminated food or water. Third, sneezing or coughing. All of these will spread the virus. Symptoms: about 90 to 95% of people who get infected with polio have no symptom at all. 2% may develop paralytic disease. Paralytic is the severe type of polio that have all the symptoms from abortive and non-paralytic. Can polio be prevented? There's no cure for children who infected with polio. The best way to prevent polio is being vaccinated and apply supportive treatment such as acetaminophen. Acetaminophen is a type of paracetamol, or we can call as painkiller. Plenty of rest, adequate diet, minimalization and exercise, hot pack or heating pads, hospitalization. Safety and medical considerations. Physicians recommend that polio survivors get a good night's sleep, maintain a well-balanced diet, avoid unhealthy habits such as smoking and overeating, and follow prescribed exercise program. Also can implement exercise that muscle group to be included and to be excluded, the type of exercise, together with frequency and duration. This is additional information that I have included in my slide. So about the statistic, Based on Jabatan Perangkaan Malaysia, as we can see at the graph chart, cases for polio is increased in 2017 to 2018, which is 1.3%. And this is the new polio cases in Malaysia after 27 years without polio cases. 3 years old baby at Sabah got infected by polio virus type 1. These cases has been confirmed by Dr. Nur Hisham, Director General of Health Malaysia last year. Next is muscular dystrophy. As you can see in the picture, the difference between normal muscle tissue and affected muscle tissue. What is muscular dystrophy? Muscular dystrophy is a group of inherited disease that damage and weaken your muscles. Can occur at any age, but most diagnoses occur in childhood. Young boys are more likely to have this disease than girls. Cause and symptoms. Due to the lack of a protein called dystrophin, dystrophin is necessary for normal muscle function, okay? So the absence of this protein can cause problem with walking, swallowing and muscle coordination. There are more than 30 different types of muscular dystrophy, and this is 9 out of 30 different types, which is Duchenne, Becker, congenital, myotonic, FSHD, limb-girdle, oropharyngeal, distal, Emery, Dreyfus. Every type have different symptoms such as Duchenne, trouble walking, loss of reflexes, difficulty standing up, poor posture, Becker, walking on your toes, frequent falls, muscle cramps, congenital, vision problems, speech problems, intellectual impairment. Myotonic dystrophy first appear in your face and neck. Symptom for FSHD, difficulty chewing or swallowing, slanted shoulder, limb-girdle, hard to get up out of a chair, stumble and fall more easily. OPMD, dropping eyelids, trouble swallowing, voice change, vision problem, heart problem. Distal, forearms, hand, calf, feet. All of these 4 problem. Emery Dreyfus, weakness in your upper arm and lower leg muscles. Breathing problem, heart problem. Same as polio, muscular dystrophy disease also there's no known cure, but certain treatments may help, such as corticosteroid drug, which is help strengthen your muscles, assisted ventilations, medication for heart problem, surgery help correct the shortening of your muscle, repair cataracts, treat scoliosis, and surgery to treat cardiac problems. Last but not least, safety and medical considerations. Muscular dystrophy no cure but can apply safety and medical consideration, but must refer to doctor and expert. The first one is corticosteroid, as I mentioned before, to strengthen your muscles. Drugs include eteplirsen, heart medications, and therapy. Therapy has been proved effective because can strengthen the muscle and increase range of motion based on healthlife.com. If you guys have a question regarding to my topic, you can inform me. Thank you.